reversed. So what we do in this case, we turn the leg upside down. So the upper chest will correspond to the area from the ankle to about liver 6. This part will correspond to the area below the ankle. The waist is always the knee. And the low belly will correspond to the thigh. Dr. Tan always said, look at me, puppy show. This is my head. This is the neck. This is the upper belly, the chest, and this is gynecological part. So all the disorders, like in vagina, we treat on the shoulder. Why? Because it corresponds to the lower area of the trunk. Let's think about TCM. If we say this is a puppy show, reverse image. So, and if we project the whole body into the arm, reverse arm, what is the best point to treat headache? Sanjiao 3, for example. Do you know that? Gallbladder headaches. Why? Look, the level of Sanjiao 3 corresponds to the level of the eyes. If we project the face to the palm. What is the best point for sinusitis? For the cold? Large intestine 4. This is where the nose is. Exactly here. What's the best point for headaches? Liver 3. And if we do the reverse image and we project the human body onto the leg, we will see that liver 3 will correspond to the level of the eyes. Where is the neck? Neck is between kidney 6 and kidney 3. Beautiful distribution. Absolutely amazing correspondence. Allows us to treat everything. And if we project the face, the human head, to the arm, we will see that direct image will give us the opportunity to treat all the disorders in the lower part of the head by needling the lower part of the arm. And the area above the eyes correspond to the upper arm area. But which area is better to needle? Lower arm or upper arm? Lower arm. Yes. Why? Because the nerve tissue is more intense here. It responds better to acupuncture, and it's much easier to find the points. It's much easier to palpate. So, if any disorders in the upper part of the head, we can reverse the arm. So, the upper part of the head will correspond to the lower part of the arm. This is the upper part. Where the eyes are? On the level of large intestine 11. That's why large intestine 11 is the best, one of the best points, star points to treat eye disorders. If we treat any pains or dysfunctions on the top of the head, we can treat the upper part of the arm. It's all here. The same happens when we project the head to the leg. It can be direct image and reverse image. And think about knee eyes. They call knee eyes not because the knee has eyes, because these 2 points correspond to the level of human eyes. Beautiful. We think geographically. We must see the exact location, looking at the human body as we look at the map. We think geographically and we think proportionately. We will refer to this system of image and mirror all the time, but the main thing you have to remember is that the mirror is the projection and correspondence between arms and arms, or arms and legs. Only limbs. Limb to limb is a mirror. Direct, when we don't turn upside down any limb, or reverse, when we turn another limb upside down. So this is mirror, limb to limb. And the image is the system when we project the trunk to the limb. It can be arm or leg, or the face to the limb. Direct projection. Either we can reverse the limb, and that will be the reverse image, and look for acupoints. When we say acupoints, in balance method, acupoints are never the points in the painful area. So if the shoulder is painful and we say acupoints, it's not acupoints on the shoulder. It's always acupoints on the corresponding limb or corresponding area. And let's say if someone has a shoulder pain and we want to treat the right shoulder, where we will find the right projection? If it is a direct mirror, so that can be another shoulder or the hip on the opposite side. But if we reverse, so we will look for acupoints on another wrist or on the ankle, because the shoulder will correspond to the ankle opposite side. This is how we treat the shoulder. We also can treat the shoulder on the side using the direct image, and it's very successful. I today treated the mirror, Today I treated one lady who didn't respond well to the treatment by conventional medicine or traditional acupuncture. She came with hip pain with 8 months of history, 10 out of 10. So I treated her hip on the left shoulder because hip is exactly the same has the same anatomical structure as the shoulder. That was good. 60% done. So this is a subject or topic where we make the most mistakes. We'll come back to this many times.